Hello and welcome to my video today on advanced care planning. Hey everyone, it's a new day. And this is something we really need to discuss if you haven't already with your healthcare provider, is what your wishes are, and a DNR, a do not resuscitate. It comes a time when we are homebound, we are living with our children, or we are living with our spouses, and that we start to see that our situations are changing. It's really good to have an idea of what you want for the advancement of your life. So it's also good when you speak with your healthcare provider when they call you for telemedicine, if you do that, and I hope you are, that you do discuss healthcare, who the healthcare proxy would be for you, and your advanced care planning. And we're going to go over some of that, but right now, due to the COVID-19 crisis, there's some things you need to think about. The older of the old, over 85, is considered the high-risk group, especially for having complications from COVID-19. And even people over 75 could have also be at high risk, especially if they have many comorbidities, or even a couple, or even one. And those would be being on dialysis from renal disease, immunocompromised situations, lung disease, where they're on oxygen and have advanced COPD, for instance, or heart disease that is pretty advanced and they're on multiple medications. So even if you're 75, you could be at risk for some complication from COVID-19. And so it's important that we all decide what we want should something happen. So the first thing is, also I want to go over with you, is who is at risk in certain areas. We have found that the lower socioeconomic groups that live in projects or in congested areas seem to be more at risk for developing complications and fatalities from COVID-19. And also, of course, we talked about dialysis patients and people with advanced lung disease, but also people who live in a house with many people. If you live alone and you don't have anyone come in, your risks are very low, of course. If you live in a house with 2 or 3 or 4 people and some of them go to work and are essential workers, they need to protect you from getting COVID-19, but your risks do go up, of course, because you're in the house with them, unfortunately, unless they stay totally isolated. Now, COVID-19 can cause just some mild or moderate symptoms, such as cough or a low-grade fever. You may have nausea or vomiting or diarrhea, flu-like symptoms. But it's the advancement of these symptoms where shortness of breath and fevers that don't go away can be a real problem for especially the people who are frail and can't handle extra burden on their bodies. So it's important to share these decision makings with your clinician, whoever that is. Decide who would be your proxy. Maybe it's not your husband. Maybe you feel that it should be your neighbor who is very close to you, or it should be your friend from far away, or which is probably harder, but you want somebody that knows you well, trusts your wishes, and makes decisions that you think are reasonable for you. And if you're alert enough to make your own decisions, you could tell the doctor what you want. I mean, I generally talk to patients about, do you want a quality of life or do you want a quantity of life? I've had many patients that were bedridden and hand-fed or had tube feedings for like 5 years. And I thought to myself, this is not a quality of life. Would they have really wanted it this way? So while we're alert and able to make decisions, and basically that's for all of us, over the age of 18, we are allowed to be in charge of making our own decisions for end of life. You have some questions you should ask your healthcare provider, like what happens if I become more seriously ill, if I get the COVID, or if I have COVID-19 and I'm doing okay, what if it progresses? And you may want to think to yourself, do I want to go to the hospital, or do I just want to stay home? The hospital does not come without risk, and it's a really hard time out there right now. So if you are one of the frail elderly, you may want to consider staying at home and making decisions of having other measures put in place for you. I know that hospice is not something that we necessarily talk about freely, but I found that it was important to tell my patients about hospice because they needed to know what it was so that when they were ready for a change, that they knew what the program was about. And to me, the hospice program was always a supportive palliative care situation if you don't want to go to the hospital and you don't want to have a tube feeding and you don't want to have IV, and you also have a disease that probably is going to not last more than 6 months, then hospice would be for you. And it's something to think about now. I believe in not having medical crisis. I believe people should be well informed so that they can decide now what kind of program they want to have. The other thing with hospice is they bring out a palliative care kit, such as medications for sleep, for pain. They take care of a nebulizer, how they have oxygen in the home. They would get you a hospital bed. They have 24-hour nurses on call to answer questions and pretty much support you. And that's really nice. And I've worked with hospice for many years, and I found it to be most helpful for me as a clinician. And sometimes patients did very well on hospice, and they ended up coming off of some of their medications, felt much better, and they actually graduated off of hospice for taking off the program if their condition didn't change for the worse. So if you are COVID positive, you may want to ask the doctors a couple more questions. Should I be tested? Who will take care of mom, and come into the house if she's positive for COVID-19? And we also talked about hospice, which is important. You may want to look online for advanced care planning for your state. Some states have different advanced care planning documents than others. In New Jersey, I use one called Pulse. In New York State, I had a healthcare proxy one-pager. Most of them do not require a lawyer or any advanced paperwork. Your clinician would put this information in your chart. They spoke with you, who's your proxy, what your wishes are, and that it was discussed so that if anything were to happen, you were ready to have your decisions granted. And isn't that what it's all about? That we have the power to make decisions for our own lives while we're alert enough to do that, or to find somebody who can do it for us when we can't. So if you are also looking for a clinician, and during this time, you could go to American Academy of Home Care Medicine and put in your zip code and see if there's one in your area, because a lot of people did not expect to be quarantined like this. And hopefully you do have health care out there. Sorry, allergy season for me. So from Nancy, the nurse practitioner, you take care for now until the next video. Follow me on YouTube at Caregiver Success.